Kerala's healthcare system stands as a shining example for India. It consistently achieves impressive health indicators. This success story is not just about hospitals and doctors. It's about a dedicated force of community health workers. These are the accredited social health activists known as ASHAs. ASHA workers are the backbone of Kerala's healthcare system, especially in rural areas. They bridge the gap between communities and public health services. ASHA workers are often the first point of contact for villagers seeking medical help. They provide crucial services like vaccinations, health checkups, and maternal care. Their efforts have been instrumental in reducing infant and maternal mortality rates. They are also at the forefront of disease prevention and health education campaigns. ASHA workers empower communities to take charge of their health. They provide information on hygiene, nutrition, and family planning. Their work extends beyond medical aid. They act as counselors, advocates, and educators, playing a vital role in Kerala's overall well-being. The ASHA program was launched in 2005. It was part of the National Rural Health Mission. The vision was clear: to strengthen healthcare delivery in rural India. ASHAs were envisioned as a link between communities and the public health system. They aim to improve access to healthcare, especially for women and children. Kerala, with its commitment to public health, adopted the ASHA program in 2007. The state recognized the potential of these grassroots health workers. The initial focus was on maternal and child health, immunization, and family planning. ASHA workers were trained to provide basic health services and referrals. The selection of ASHA workers was community-based. Women from within the villages were chosen, ensuring familiarity and trust. This approach proved highly effective. ASHA workers were not outsiders, but individuals known and respected within their communities. Over time, the role of ASHA workers has evolved significantly. They are no longer limited to basic health services. Their responsibilities now encompass a wide range of health issues. This expansion reflects their growing importance in the healthcare system. ASHA workers are now involved in non-communicable disease management. They conduct screenings for diabetes, hypertension, and cancer. They provide counseling and support to patients. They play a crucial role in palliative care, offering comfort and care to the terminally ill. Recognizing the importance of mental health, ASHA workers are also being trained to identify and support individuals facing mental health challenges. They provide basic counseling and referrals to specialists. During the COVID-19 pandemic, ASHA workers emerged as frontline warriors. They conducted door-to-door surveys, contact tracing, and vaccination drives, risking their own safety to protect their communities. Despite their invaluable contributions, ASHA workers in Kerala face numerous challenges. They often work long hours, stretching beyond their designated duties. Many report working 7 days a week, attending to emergencies even on their days off. Their workload has increased significantly with the expansion of their roles and the introduction of digital health initiatives. The burden of data entry using mobile applications adds to their already demanding schedules. Despite their hard work and dedication, ASHA workers receive meager compensation. Classified as volunteers, they are denied basic labor rights and social security benefits. This classification is a misnomer. It fails to recognize the demanding nature of their work and the essential services they provide. The current honorarium of 7,000 rupees per month is far below Kerala's minimum wage and inadequate for their efforts. Section 5. A cry for dignity. The ongoing protests of Kerala's ASHAs. Frustrated by the government's inaction, ASHA workers in Kerala have been protesting for their rights and demanding fair compensation. They are demanding an increase in their monthly honorarium to 21,000 rupees, which is more in line with the state's minimum wage and reflects the value of their work. Their demands go beyond just a pay hike. They are seeking recognition as workers with all legal entitlements, including social security benefits, pension, and gratuity. They are demanding better working conditions, including timely payment of wages, adequate protective gear, and transportation facilities. The protests have taken various forms, from sit-in demonstrations and hunger strikes to symbolic head shaving and a 45-day statewide march. They have garnered support from various quarters, including artists, intellectuals, and other labor organizations. Section 6. The Price of Neglect, a comparative look at ASHA. Compensation. The plight of ASHA workers is not unique to Kerala. They face similar challenges across the country. However, the disparity in compensation between Kerala and some other states is stark. While Kerala provides an honorarium of 7,000 rupees, states like Sikkim offer 10,000 rupees. Andhra Pradesh provides a gratuity of 1 lakh rupees upon retirement, demonstrating a greater recognition of their service. Karnataka recently increased the honorarium to 10,000 rupees following ASHA strikes. These comparisons highlight the urgent need for Kerala to improve the compensation and working conditions of its ASHA workforce. Section 7. A call for action recognizing and rewarding ASHA workers. ASHA workers are the unsung heroes of Kerala's healthcare system. They are the pillars of public health, particularly in rural areas. Their tireless efforts ensure that essential healthcare reaches the most vulnerable sections of society. It is high time that their invaluable contributions are recognized and rewarded. The Kerala government must address their demands with utmost urgency. Providing fair compensation is not just a matter of social justice. It is an investment in the health and well-being of the state. Ignoring their plight will have serious consequences for the entire healthcare system. Section 8. Beyond recognition, concrete steps for ASHA empowerment. Recognizing ASHA workers as workers with full labor rights is a crucial step towards empowering them. This will grant them access to social security benefits, ensuring a life of dignity after retirement. Providing them with a living wage will not only improve their standard of living, but also attract and retain skilled individuals in this vital workforce. Improving their working conditions is equally important. Providing essential resources like uniforms, protective gear, and transportation will enable them to perform their duties more effectively and safely. Reducing their workload, particularly the burden of digital data entry, will prevent burnout and ensure their well-being. Section 9. The future of healthcare, investing in ASHA workers. The future of healthcare in Kerala, and indeed in India, hinges on the well-being and empowerment of ASHA workers. Investing in their training, providing them with the necessary resources, and ensuring their job security will strengthen the entire healthcare ecosystem. Empowered ASHA workers translate to healthier communities. Their close ties with the communities they serve make them invaluable assets in healthcare delivery. Their role will become even more critical in the years to come as India faces the challenges of a growing population and the rising burden of non-communicable diseases. The fight for ASHA rights is a fight for the right to health for all. It is a fight that deserves our unwavering support.